I'm Ann Steffen, and I'm affiliated with the University of Missouri St. Louis and the Optimal Aging Center. This is an overview of the Skills for Managing Chronic Pain personalized module from the Treating Later Life Depression Workbook and Clinician Guide through Oxford University Press. So, the Skills for Managing Chronic Pain is one of a series of personalized modules that are offered within this treatment approach. And I'll just sort of point out as we get started with today's overview video that for all of us, myself included, when we're first starting to either learn to apply a specific intervention approach or use new materials, we feel a little bit uncomfortable, a little bit unsure. And it usually takes all of us the opportunity to use materials with 2 to 3 clients to just get a little bit more comfortable, to have a lay of the land. And so as we've developed the second edition, we've really done everything that we can in creating those learn pages and practice forms that really provide the majority of the information you're going to need on the pages themselves as you're working with your clients. And so we've really tried to make this a really light lift, to take away lots of expectations for clinicians to retain a lot of information on their own. And so with that in mind, we just encourage you to try these materials with a couple of your clients and get a sense of which are the best fit for your specific practice setting. So at the same time, for those of you who are not working within relatively brief models of intervention, such as integrated primary care, EAP, care management. So for those of you who are working in traditional psychotherapy, we'd like to encourage you to resist the temptation to jump from module to module to module very frequently with an individual client. In our work in individual psychotherapy with older adults, we're building upon that concept of habits, which means a lot of repetition of the same content from day to day to day and week to week in order to build new skills that are then going to be able to be applicable during times of high stress. And so we've certainly done what we can in as we've developed the second edition for the Treating Later Life Depression approach to build upon the research that we have in psychology of habit, both formation and habit change, to inform our approach. So in this orientation video, we're going to be providing a relatively brief overview of the Skills for Managing Chronic Pain personalized module. I'll be providing some additional tips and reminders for strategies to use within session with middle-aged and older clients. And then I'll be pointing you to specific areas of the Later Life Depression Clinician Guide where you can get additional information. And we do think that you're likely to get the most you can out of this overview if you have the Later Life Depression Workbook and the Clinician Guide in front of you as you're going through this orientation video. So again, in the Treating Later Life Clinician Guide, this is in Chapter 12, where we discuss the skills for managing chronic pain. And that's on pages 201 to 214. We've really done everything that we can to make each of the chapters in the clinician's guide very to the point and to include a lot of practice-friendly clinical tips for your use with clients. As you can see, there's a number of both forms affiliated or associated with this module. We would never expect you to use all of these materials with any one client. The whole point of the way that we've organized the second edition is to provide sort of a compendium resources so that you can pick and choose materials that are going to be the best fit for your work with a given individual. And so we are using Pam Hayes' addressing model as we're thinking about the work that we do with our clients and seeing age and generational status as facets of identity that are then intersecting with a range of other cultural identities. And so with that in mind, we're really emphasizing our work with cultural respect at the forefront as we're both doing our assessment and our treatment planning. We're spending quite a bit of time early on in this treatment approach, identifying culturally related strengths and supports and building from those. and that it's particularly important to clarify what parts of the client's presenting concerns are really external to themselves or environmental challenges that we want to help them problem solve and or shape or change their physical and social environments. And then when are we paying attention to areas where they do need to develop skills within themselves? And we're always really staying mindful of the cultural influences in these processes. And so one of the ways that we do that is in the first module within the workbook with clients, and that's the skills for getting started. And we have a number of resources within that module to help clinicians do this work. You can see here two examples: Start, 11, Learn, which is the Celebrating Diversity page, which would be done in session with clients, having a copy of this in front of them at the same time that you have a copy in front of you, and then having this discussion about the facets of their identities that are most important to them, and how they see that as related to their own personal strengths and values, as well as the individuals in their lives who both share both facets of diversity and share their values and strengths with. So these are two forms that we think to be relatively important in that first phase of orientation to treatment. And so in terms of assessment, in chapter 3, the clinician guide, we have a whole section focused on identifying assessment related concerns, some recommendations. And then in the clinician guide, appendix D, we provide practice ready forms that could be used for specific recommended assessment tools. So there's more resources there for you if that's something that you're interested in. So specific for managing chronic pain, we are not considering this CBT for chronic pain. We're really using this as a psychoeducation and a basic support approach. And so we're providing some information about how the differences between long-term pain and short-term pain, and then helping folks develop some specific coping strategies. And so one of the things that we do relatively early in this module is introduce that gate-controlled theory of pain with a very sort of simple metaphor of gates opening and closing. And then we link that to specific gate control practices. So experiences that open the gates and increase our perceptions and experiences of pain, and things that such that fewer pain signals are reaching the brain. And so, an example of a very sort of open-ended version of a between session assignment is Pain 2 Practice, which is really just across all of daily life, identifying situations and habits that increase sensations of pain for a given individual, and then habits that close. So this is the broadest, most general approach to this idea. And then throughout the rest of the module, we sort of systematically go through a range of specific life domains. And this is an example of the physical and behavioral factors that both can open the pain gate and increase sensations of pain, and things that then can close the pain gate. And then we have a between sessions practice form that's linked to this specific learn form. And here's what that would look like. Again, a very open-ended, meant to be a simple way of journaling to really identify specific events in that individual patient's life that are contributing to or providing some relief from pain experiences. And then we do the same thing on the cognitive front, and introducing some of the cognitive factors or thought habits, thinking habits that can contribute to our sensations of pain, and then things that may help close the pain gate. And then we do the same thing for emotional factors and talk about how our emotional experiences can interact with our perceptions of pain. And then in the same way that some more acceptance-based emotional strategies may then also help reduce the sensations or the experiences of pain. And so, here in Pain 6 Practice is an example of a different type of a form that we provide as an option for you to use with your clients. And that's this checklist approach where we provide a variety of possible strategies, and then over one or multiple weeks, individuals are then using that as kind of like a reminder, right? Based on recognition memory, to where they can just like look at this and say, oh yeah, these are some of the strategies that I could try over the next week. And then to do a little bit of reflection on strategies that appear to be especially the most helpful. So here's another example of a different type of a form that doesn't even require a checklist, but then provides the days of the week, such that clients can then circle the days of the week in which they're working on specific strategies. And you see that we're doing quite a bit of attention on issues of pacing and linking in with still aspects of life that are meaningful and rewarding for that individual. So staying connected to both developing daily routines that involve pacing and not overdoing, and yet that are still connected to aspects of life that are meaningful and rewarding and interesting. And so here's another different type of a form, and you can see the variety that we're providing, because we know that some work better for some individuals than others. So any one client wouldn't be expected to use all of these, but really has an opportunity to sort of select the type of a between session tracking form that's the best fit for them. And then, the one thing that we do towards the end of this module is really differentiate this approach that we've provided in this module, which is a basic psychoeducation and basic support for pain management strategies versus a formal pain management treatment. So we don't consider this to be a full course of cognitive behavioral therapy for pain management, but something that could be integrated in with other work that you're doing with middle-aged and older adults who are struggling with depression. And so, again, as you're working with clients within this module, we have provided in the clinician guide a little superscript T to denote the materials that we found to be the most compatible for work within telehealth practices. So, we don't have a prescribed program where you're expected to go session to session with specific forms, but sometimes clinicians ask us for that. So we have in the clinician guide provided some proposed session formats to have a sense of which of the forms relate and fit in with others. So you see here in a sample session 1, in which you're reviewing progress on other aspects of psychotherapy, and then beginning to provide some basic psychoeducation about chronic pain and understanding those linkages between pain and depression. And then in session 2 is an opportunity to begin to provide some education about pain control theory, areas of pain management, and specifically to be looking at those aspects of physical activities. And of all the 3 physical activities, cognitive strategies and emotional, we really encourage you to prioritize and begin with those physical activities, given how much the issues of pacing versus overdoing and the cycle of overdoing and having pain flare-ups is such a common cycle for so many of our patients. Then in sessions 3, we provide an opportunity for you to at least introduce and discuss cognitive strategies and emotional strategies. And even as you're going through those 2 learn pages, then it's an opportunity with given clients for them to sort of pick and choose. Well, this feels like the focus on the cognitive, what I'm telling myself seems to be an important area for me versus the way in which I'm managing my emotions and how that's linked to my pain experiences. So again, you may not do all of these forms, but you may pick and choose as you're looking at these with clients and collaboratively working with them on identifying the things that really sort of resonate in their specific situations. And then in a session 4, and you can see that overall, this is sort of like a 4-session approach to at least introducing this area and beginning to look at it, is an opportunity to decide whether these 4 sessions have been important enough or related enough to a client's experiences with depression that they want to revise some of their therapy goals and begin to especially develop some more detailed personalized goals that are related to pain management for themselves, and then an opportunity to do some reflection and review. So, the tips that we provide in the clinician's guide specific to pain management are listed here. And you can see that there's a number of them. And we go through these in more detail on pages 204 to 206 within clinician guide. We certainly want clinicians to be aware of and paying attention to sudden changes in pain experiences. Usually sudden changes are an indicator that something physiologically is going on that needs attention through medical care. We emphasize the importance of validation and really sort of accepting at face value what clients are bringing in and discussing in terms of their pain experiences. And then what we know about chronic pain compared to acute pain is that some fraction is less helpful. And so we really are emphasizing in this whole personalized module a focus on attention to personal values and strengths and values consistent behaviors rather than just mere distraction. And then there's an opportunity for some clients who may be engaged in physical therapy or reconsidering whether this is a good time for work in physical therapy with them to really help your clients sort of focus on and benefit from the physical therapy that they're getting. And then we spend some time discussing pain-related cognitions and the times in which it may be appropriate to move from this module back to the core skills for thinking module that covers cognitive reappraisal and more traditional cognitive therapy approaches for later life depression. And I started out this overview just sort of reminding us that we're building habits here. So although we're providing some psychoeducation and some suggestions, we do not believe that mere provision of information is sufficient to lead to change in our clients' lives, and that what we're doing for those of you who are working in traditional psychotherapy settings is that systematically helping individuals build healthier habits. So that's a lot of repetition and over learning and development of backup plans. And so we'd really like to encourage you, even within the pain management module itself, for them to be focusing on one or two specific strategies at a time in clients' work in this area. And just knowing that the work you're doing with middle-aged and older adults who are struggling with both depression and chronic pain conditions, that you should be expecting a lot of work that's repetitive in nature and that's then applying to new situations in daily life. So again, this is covered in chapter 12 of the clinician guide. And one of the things that we do throughout this entire treatment approach is emphasize how important this ongoing routine monitoring of outcomes for our patients is. And we are now at the point in psychotherapy where the data on the importance of clients and patients being able to track their therapy goals and their progress on an ongoing basis, that this is so helpful and so much linked to improved psychotherapy outcomes that it's considered a part of good ethical clinical practice. And so to support this within the skills for chronic pain module, we have an opportunity at the beginning of your use in that module in Pain One practice to review their ongoing sort of continued therapy goals that have been developed earlier on and sort of track where they are at in their attention to and meeting their specific therapy goals. There's an opportunity in the chronic pain module to develop a new personalized goal that's specific to managing their chronic pain, and you work within session and helping them turn that into a goal that is specific enough that meets that criteria of a SMART goal that can be tracked over time in a meaningful way. And then in every one of our modules, we end towards one of the last learn pages that's provided is a reminder of how to be thinking about progress in psychotherapy and really in any change effort that for all of us as we're working on change, we're not working We're not expecting improvement to go in a linear fashion or in a very gradated stair step. Instead, it's a jagged sawtooth curve with lots of ups and downs, but that over time that we're expecting progress to be made. And that because of that sawtooth pattern is one of the reasons why it's especially important for you and the clients together to be collaboratively tracking their progress towards goals. Because once there's been a setback, for individuals who are struggling with depression, they can become demoralized, feeling hopeless, and really have a sense that nothing's changed and they haven't made any progress. And instead of you just verbally saying, well, I do think you've made progress, and here's what I've noted, the ability to look over time at tracking specific therapy goals and for them to sort of note that you have some documentation of ways in which there's been improvement can be particularly important in staying hopeful and staying engaged in treatment when there has been a setback. And then, so, we provide in the clinician guide a range of tips for managing within session process. And here are a couple of those recommendations. And again, you're paying attention to how you're beginning your sessions with clients. You're stepping away from asking, how are you? How's your week been? What do you want to talk about? And instead, you're providing a warm greeting. It's so good to see you today, Karen. Let's get started by reviewing your therapy goals and seeing how those are doing. And then we'll develop together a short list of how we're going to spend today's time. And then, we provide within the later life depression workbook and the skills for getting started, some resources to help with that process. And middle-aged and older clients are familiar with and comfortable with the idea of preparing for medical appointments with their primary care physician, with a specialist. And we develop the skill of them doing this in preparation for individual psychotherapy or a primary care appointment as well. And the main focus on all of these, both the session preparation sheet and later on the session summary sheet, and that these are supposed to be just a couple words or phrases. This isn't a lot of writing. We're really intending more than a 5 or 10-minute exercise. And either the day before or the morning of an appointment, providing some space for the client to prepare in advance of their time with you. So that they're walking in with a sense of whether there's been major changes in their life that they want to report to you, that they do have some high priority areas that the two of you are going to negotiate. How is that going to be reflected in your session agenda? And throughout all of this work, we really encourage clinicians to stay focused on the specifics. That we think that overly abstract discussions that are about life in general, relationships in general, very generalized problems, make it difficult for individuals and you to focus enough to lead to then some concrete and strategic changes. And so we'd like to encourage you to work with specifics, experiences on a specific day, things that can be given a date and a time to them will then help you stay anchored in how this work in therapy is going to relate to quality of life on a daily basis. And then part of that work is involving work between sessions. And the majority of cognitive behavioral writers have sort of said that if your work does not involve some form of a concrete exercise or opportunity to practice skills between sessions, you're not doing cognitive behavioral therapy. So we're really encouraging individuals to do some skill application between sessions, and that's to be done collaboratively, that time is provided in session to begin any practice form in session, whether it's face-to-face or in telehealth, that you've agreed upon specific days or specific times of the day when that assignment is going to be completed. You've anticipated things that may get in the way and you problem solve those barriers. So in essence, what we're saying is for any of the practice forms within the workbook, including those in this chronic pain module, once you're away from session and a client is working on something between sessions, they should always have something already written down on the form that provides an example from their own life that then makes it easier for them to continue to work on that form. So here's an example of that Start 3 practice form. That's a really brief session summary form that we encourage you to provide a little bit of time towards the end of your sessions and sort of coaching the individual to write down what are the main things that we focused on, what would you especially like to remember, what did we agree upon that was going to be that within session practice. Are there any specific practice forms from the workbook involved in that? And is there anybody in my life that I want to call upon to help support that? And then a reminder for the next session time. And so, as you can tell, session pacing is a relatively important part of this work. And we want to make sure that there's enough time at the end of the session to be able to do that brief summary of key points that are written down, to clarify questions about home practice, to have that end of session feedback sharing, and especially for you as a clinician to say, before we get started, before we wrap up today, I just wanted to check in. Is there anything that I said or did that didn't sit well with you, that felt off? Let's talk a little bit about that now. And then to also do some hope installation, which is a very, very important part of working with depressed middle-aged and older adults. It doesn't mean to be this inauthentic cheerleading rah-rah, but meant to be gentle encouragement of the signs that you are seeing of progress, and the reasons why you have to be hopeful for their work in the program. And so here's an example of the final practice form within the chronic pain module that provides an opportunity to consolidate some of the work that has been done in the area of chronic pain management, for them to identify practice forms that they've particularly used and liked, what they've learned that's been the most important to them, and then a little bit of time towards the end of this module to sort of consolidate and to look forward to, okay, so what are the examples in the future that are common for me? And then what do I want to remind myself in terms of the skills that I have, or in terms of specific forms or materials that might be helpful in those specific stressful situations. We provide 3 different tip sheets that are freely downloadable at the Optimal Aging Center that we think are a good summary of some of the strategies that are generally applicable across all the modules of the Later Life Depression workbook. And then within the Optimal Aging Center, there are also some opportunities for consultation that clinicians have. With that, as a wrap up, we've now finished our overview of the skills for managing chronic pain, and I hope that you found this helpful.